As a doctor, I often get asked about circumcision. It's a topic that sparks strong opinions and emotions. People are curious about the procedure itself, its history, and its impact on health and pleasure. This is a safe space to discuss these issues openly and honestly. My goal is to provide you with accurate and balanced information. I will delve into the science, the history, and the cultural significance of circumcision. I believe that knowledge is power. When we understand the full picture, we can make informed decisions about our bodies and respect the choices of others. This isn't just a medical discussion, it's a human one. Circumcision has deep cultural and religious roots. It's a practice intertwined with identity and beliefs. We need to approach this topic with sensitivity and respect for all perspectives. In the following sections, we will explore the many facets of circumcision. Together, let's navigate this complex issue with understanding and compassion. Circumcision has been practiced for thousands of years. Its origins are diverse and span numerous cultures. Evidence suggests it was performed in ancient Egypt. We see depictions in artwork and even mummies with evidence of circumcision. The practice also holds religious significance. In Judaism, it's a sacred covenant. Jewish boys undergo circumcision shortly after birth in a ceremony called a bris. In Islam, circumcision is also practiced. It's considered a sign of cleanliness and a step towards religious devotion. Circumcision has also been part of tribal traditions in various parts of Africa and Australia. The reasons vary. Sometimes it's seen as a rite of passage into manhood. Other times it's linked to beliefs about hygiene or social acceptance. Understanding the historical and cultural context helps us see why this practice persists today. It's not just a medical procedure, it's a deeply ingrained tradition for many communities around the world. From a medical standpoint, circumcision is a relatively simple procedure. It involves removing the foreskin, the skin that covers the head of the penis. While generally safe, like any surgery, it carries potential risks and benefits. Some studies suggest that circumcision might offer a slight reduction in the risk of urinary tract infections, particularly in infants. There's also some evidence that it may lower the risk of certain sexually transmitted infections, like HIV, though this is still debated. However, it's crucial to note that circumcision is not a guarantee against these conditions. Safe sex practices and good hygiene remain crucial, regardless of circumcision status. On the other hand, any surgery has risks. With circumcision, these can include bleeding, infection, or complications with healing. These are typically minor, but highlight the importance of skilled medical professionals performing the procedure. One of the most debated aspects of circumcision is its potential impact on sexual pleasure. This is a sensitive topic, and research in this area is complex and often inconclusive. Some argue that the foreskin contains numerous nerve endings and that removing it might decrease sensitivity. Others contend that the difference in sensitivity is minimal and that sexual satisfaction is influenced by many other factors. It's important to remember that sexuality is highly individual. What feels good varies from person to person. There's no one-size-fits-all answer when it comes to circumcision and sexual pleasure. Open communication with your partner, exploration, and understanding your body are far more crucial for a fulfilling sex life than circumcision status. Section 5. Keeping it clean. Hygiene and circumcision. Hygiene is another area where circumcised and uncircumcised penises differ slightly. With the foreskin present, cleaning requires gently pulling it back and washing underneath with soap and water. For those who are circumcised, the head of the penis is exposed, making cleaning straightforward. However, it's still essential to wash the area regularly to prevent irritation or infection. Good hygiene is vital for all men, regardless of circumcision status. It helps prevent unpleasant odors, infections, and promotes overall genital health. Section 6. A matter of identity, circumcision, culture, and beliefs. For many, circumcision is more than just a medical procedure. It's deeply intertwined with cultural or religious identity. For Jewish communities, the bris is a sacred covenant. In Muslim families, it's often seen as a symbol of faith. These beliefs should be respected and understood. It's not our place to judge or impose our views on practices that hold deep spiritual significance for others. It's also important to acknowledge that some individuals might feel a strong sense of identity tied to their circumcision status, regardless of the reason behind it. This is a personal matter, and respecting individual feelings is paramount. Section 7. The ethics of circumcision, consent, and choice. In recent years, there's been growing debate about the ethics of performing circumcision on infants who cannot consent to the procedure. Opponents argue that it's a violation of bodily autonomy and that the decision should be left to the individual later in life. Proponents counter that it's a safe procedure with potential benefits. They argue that parents have the right to make medical decisions for their children, especially when those decisions are based on religious beliefs. This is a complex ethical dilemma with valid points on both sides. Open and respectful dialogue is essential to navigate this sensitive issue. Section 8. Bridging the divide, respecting different perspectives. The circumcision debate can be polarizing. People feel strongly about their beliefs and experiences. However, it's crucial to approach this topic with empathy and respect for all viewpoints. Just because someone has a different opinion doesn't make them wrong. Engage in respectful dialogue, listen to understand, not to respond, and try to find common ground. Ultimately, the decision of whether or not to circumcise is a personal or family one. We should strive to create a society where those choices can be made freely and without judgment. Section 9. A final word, making informed decisions. As we've seen, circumcision is a multifaceted issue. There are historical, cultural, medical, and ethical considerations. The most important takeaway is the need for accurate information and respectful dialogue. If you're considering circumcision for yourself or your child, consult with a healthcare professional. Gather all the facts, weigh the potential risks and benefits, and make a choice that feels right for you. Remember, there's no right or wrong answer. What matters most is making an informed decision that aligns with your values and beliefs. Let's foster a culture of understanding and respect surrounding circumcision.